Welcome to the Deep Dive. Today, we're going to be exploring healthcare in Nagaland.
Oh, interesting.
Yeah, we're going deep on this podcast called Healthcare in Nagaland, Government's Role and Challenges. And wow, there are some challenges.
I bet.
Like over 70% of Nagaland's people live in these rural, mountainous areas.
Yeah.
So getting healthcare is really tough.
Yeah, I can imagine. It's not as simple as just not having a hospital nearby.
Right.
You've got the mountains, the roads, the distances just to get basic care.
It's a lot, yeah.
It all kind of comes together. The geography, what they've built up, and just what they have to work with.
So we're talking days of travel just to see a doctor,
Yeah.
potentially. What's that do to the whole healthcare system there?
Well, you almost get two different worlds. Kohima and Dimapur, the main cities, they've got more, but the rest of the state,
Struggling.
yeah, they've got this three-tier system, tertiary, then district or community level, then basic primary care, but it all goes to the cities.
So everything gets funneled to that one major government hospital, the NHAK.
Exactly. Naga Hospital Authority, Kohima, it's under a lot of pressure. And Dimapur has the Christian Institute, CIHSR, which is good. It's private, but still, just one place.
Not enough.
Nope. And for anything really specialized, a lot of folks have to go outside Nagaland altogether.
Assam,
or even Delhi, yeah.
wow. That's more than just inconvenient.
Oh, absolutely.
That's like life or death delays in getting treated.
For sure. Think about it. You got to miss work, it costs money, and you're leaving your family.
Right.
All to maybe get care that isn't even guaranteed to be good.
It's like a huge burden on people.
Especially in those rural areas, yeah. Tough situation.
But the government's got some programs, right? Trying to make things better.
They are. There's this Nagaland Health Project. It's World Bank backed. They're focusing on rural areas specifically.
Okay.
Upgrading buildings, services, especially for mothers and kids, and communicable diseases, even training healthcare workers.
Seems like they're hitting it from all sides, which is good.
It is. And then there's these big insurance schemes, Ayushman Bharat, the PMJAY one, and the chief ministers.
Right.
They give free insurance up to 5 lakh rupees to make healthcare affordable.
That's huge. But is it actually reaching people?
That's where it gets tricky. The podcast, it points out there aren't many hospitals actually signed up for these schemes.
Oh, no.
So even with the money, it's hard to get the care. Just having the policy isn't enough,
Yeah, got to put it into action. What else is the government doing?
Well, the National Health Mission, the NHM, they're putting money into rural healthcare too. But
Right.
They just don't have the doctors and staff, no one to do the work. Attracting and keeping people in those areas is really tough.
So even with money and programs, there are still these fundamental roadblocks.
Definitely.
Has tech helped at all?
There's hope there. Telemedicine, that digital stuff. They're trying to use that to close the distance gap.
So a specialist in Kohima could help someone far away.
That's the idea. But the internet is really bad in those mountains.
Oh, right.
It's a big obstacle. Shows you need the infrastructure to make tech really work. Like the podcast, it describes how rough it is out there. Lots of villages don't even have basic clinics.
Wow.
And even if they do, getting there. Hours, sometimes days, on bad roads, especially when it rains.
So a checkup could turn into a whole ordeal. Makes you think, right, we just jump in the car, go to the doctor.
Totally.
Not there. It's dangerous, uncertain.
Yeah. And then on top of that, you've got the doctor shortage. Not enough specialists, especially outside the cities.
Right. The podcast talked about that. Tough to blame people, though, right? Kohima, Dimapur, they've got better facilities, more to do.
It's understandable. The government's trying. They've got these incentives to get doctors to go rural. But it's more than just money, Career stuff, keeping up their skills, even just feeling like part of a bigger team. You get that in a city hospital.
It's a whole system issue then, not just choices. So as long as that's the case, Nagaland has to rely on other states for the serious stuff.
Sadly, yeah. Like the podcast says, if you need heart surgery, cancer care, that kind of thing, it's Assam or Delhi. Imagine that on a family.
The cost, the stress.
Having to uproot your life just to get treated?
Yeah.
Tough.
It really highlights how much Nagaland needs to build up its own specialty care. But that takes a ton of investment, right? Money, training, which they're short on already.
Long road ahead, that's for sure. And then there's the diseases they're dealing with. It's a lot.
Yeah, the podcast was pretty upfront about that. The HIV/AIDS rates are really high, a major problem. What else is going around?
You've got tuberculosis, malaria, and now more and more of the lifestyle diseases like high blood pressure, diabetes.
It's like, oh, it's hitting them from all sides.
Yeah.
Rough situation. But surely there's got to be some good news, some hope.
Yeah.
Did the podcast talk about solutions?
It did, and I think that's important, right? To not just dwell on the problems, but look at what could be done.
For sure.
They talked about expanding private healthcare, like that CIHSR place in Dimapur. That's a good model.
Yeah. But is there enough to get other private places to invest, especially out in the rural area?
That's the key. The government's got to make it worth it, you know? Tax breaks, help with building stuff, whatever it takes. Imagine if there were more CIHSRs all over.
Bringing that specialized care closer to people.
Right. Using what the private sector can do to fill the gaps. And they even talked about these PPPs, public-private partnerships.
Right. Sharing the responsibility.
Exactly. They could do so much. Labs, special clinics, that telemedicine stuff, even training local healthcare workers together.
That training part is interesting to me, like empowering the communities themselves.
Totally sustainable. Gives people ownership, that's what lasts. Imagine. Nurses, techs, community health people, all trained up, taking care of their own.
Could really change things. So we're seeing a shift then, not just relying on the government, but bringing everyone in. Private sector, local folks, using tech.
That's it. And the podcast, it ended with some actual recommendations, you know? Concrete stuff to make the system better. A&D, encourage new ideas.
Okay, lay it on me what they say.
Big one is boosting those district hospitals. Give them better equipment, get specialists out there so people don't have to travel so far for every little thing.
Building up Nagaland's own system so they're not always dependent.
Right. They also want a better system for emergencies. With all those mountains, getting people where they need to be fast is crucial.
Especially when time is of the essence. Anything else that jumped out?
More digital health, more telemedicine. If they can fix that internet problem, specialists could be helping people all over the state. Remote diagnoses, checking up on treatments, even training, all from far away.
Breaking down those barriers. Bringing care right to people, basically. Powerful stuff, especially in a place like Nagaland.
And lastly, they talked about education. Campaigns, you know, to teach people about health, get them taking care of themselves proactively.
Shifting from reacting to preventing. Love that.
Exactly. Hygiene, food, catching diseases early, building a system that's not just about fixing you when you're sick, but keeping you healthy.
It's a whole mindset change.
Yeah.
So we've gone from like kind of depressing to maybe hopeful. There's so much to overcome in Nagaland, but it seems like they're ready to try new things.
It's been really interesting for me, too. What gets me is they're facing all this, but they're still looking for ways to innovate. Like, healthcare doesn't have to be the same everywhere, you know?
Right. It's got to adapt to the place and the people.
Nagaland shows that instead of the big hospital being the only answer, they're thinking about spreading it out, making it more local, more community-based.
It's like they need the fancy stuff, but to get that, they need the experts. But to get the experts, they need... It's a chicken and egg thing almost.
Yeah, I see what you mean. It takes some outside-the-box thinking, you know? We talked about those partnerships in telemedicine, but what if they had, like, regional hubs?
Hubs?
Yeah, for the specialized stuff.
Yeah.
So instead of one big center, you have a few spread out strategically.
Okay, so like mini specialty centers, but closer to more people than just Kohima or Dimapur.
Exactly. And they could be all connected digitally, right? Using that telemedicine to link up specialists with the rural areas.
Getting the most out of what they DO have.
Yeah.
This idea of bringing care TO people keeps coming up. What about like mobile clinics? Ones that actually go village to village?
Could work. Or have you heard of those telehealth kiosks? Like little booths with tech in them, solar powered, put them out in remote spots.
It's like a modern day, well, but for healthcare.
Yeah.
I love that. Shows you need both. The tech and the thinking to adapt it to Nagaland. They could be a model for others, you know.
Absolutely, turning their problems into how they get ahead. And it's not just gadgets either. Those community health workers, we talked about them. What if they were even more equipped?
Like how so?
Give them portable testing kits so they can do basic checks, maybe even some diagnoses right there on the spot.
It's like having a medical first responder right there in the community, someone who gets the local situation.
Exactly. They could spot problems early, get people to the right place faster, even help manage long-term illnesses. It'd be healthcare woven into the community itself.
Man, this deep dive started out kind of grim, but now I'm feeling optimistic.
Yeah.
Honestly.
Yeah.
Nagaland's got a long way to go, but they're not afraid to try stuff.
Yeah. It's been eye-opening for me, too, seeing how much they're doing with so little. And it makes you realize healthcare doesn't have to be this one-size-fits-all thing, you know?
It's got to be tailored to where you are.
That's what Nagaland is showing. It's not just about the big hospital at the top. It's about bringing care down to the people, making it part of their lives.
It's about more than buildings. It's about the people, right?
That's what gives me hope. There's no single answer. It's going to be a bunch of things together. Better facilities, empowered communities, new ways of thinking.
So anyone listening out there, what ideas do you have? How would you tackle this in Nagaland? What's possible if we stop assuming healthcare has to look a certain way?
Keep thinking about it, folks, because places like Nagaland, they're going to need all the good ideas we can come up with.
Well, thanks for joining us for this deep dive into Nagaland's healthcare. It's been a journey, that's for sure, and hopefully it's got you thinking too. Keep those brains buzzing, folks, and let's all work towards a healthier future for everyone.
Welcome to another deep dive, everyone. Today we're headed all the way to northeast India to explore the healthcare system of Mizoram.